Before we even touch a syringe or switch on a monitor, there's one crucial question we must answer. How risky is it to anesthetize this patient? To answer that, we don't guess. We categorize risk using a universally accepted scale, the ASA Physical Status classification. Developed by the American Society of Anesthesiologists, this simple yet powerful system helps us speak a common language when it comes to patient risk across all levels of care. Patient 1, ASA I, a 20-year-old healthy college athlete, is scheduled for an elective ACL repair. He is a non-smoker, non-drinker, takes no medications, and has a normal BMI of 23. ASA Class 1, a normal healthy patient with no systemic disease. Patient 2, ASA II E, a 19-year-old student, requires emergency surgery following a motor vehicle accident. He has a BMI of 29, overweight, uses alcohol and cannabis recreationally, and has well-controlled GERD. ASA Class 2E, a patient with mild systemic disease undergoing emergency surgery. Note, a full stomach doesn't change ASA classification but increases anesthetic risk. Patient 3, ASA III, a 30-year-old woman, is scheduled for elective surgery to remove an ovarian cyst. She has anemia from menorrhagia, type 2 diabetes on metformin, and a BMI of 42. ASA Class 3, a patient with severe systemic disease, here morbid obesity and diabetes. Patient 4, ASA IV E, a 70-year-old woman, is scheduled for emergency laparoscopic appendectomy. She has a 100-pack-year smoking history, poorly controlled COPD, morbid obesity, BMI 46, and insulin-dependent diabetes. She becomes breathless after minimal exertion. ASA Class 4E, a patient with severe systemic disease that is a constant threat to life, undergoing emergency surgery. Patient 5, ASA E, a 55-year-old man, is brought in after a fall from a horse with a large abdominal aortic laceration. He suffered circulatory arrest in the ER and required CPR. He is receiving massive transfusions and has multiple life-threatening injuries. ASA Class 5E, a moribund patient not expected to survive 24 hours with or without the operation. Patient 6, ASA VY, a 25-year-old man, is declared brain dead after a motorcycle accident and is now being prepared for organ donation. ASA Class 6, a brain dead patient whose organs are being removed for donation.